Imagine a time when medical mysteries were solved with methods that would make your skin crawl. Throughout history, there have been numerous medical procedures that, by today's standards, would be considered horrifying or barbaric. Here are 5 bizarre historical medical procedures you wouldn't want to experience yourself. Trepanning. Have you ever thought about drilling or scraping a hole in someone's skull to ease a headache? No? Well, in ancient times, it was an actual procedure some practiced. The procedure was done to treat head injuries, fractures, or infections. In ancient times, there was little to no anesthesia or pain relief during the procedure, meaning the patient would be awake and aware during the surgery. When was trepanning performed? Trepanning is one of the oldest surgical procedures known to humanity, dating back from around 7,000 to 10,000 years ago up until the 19th century. It was believed that creating an opening in the skull could release pressure and promote healing. Due to improved knowledge and surgical techniques, trepanation eventually stopped being a mainstream procedure. Bloodletting. Imagine a time when healing meant letting blood flow. Bloodletting was a historical medical practice that involved the removal of blood from a patient with the belief that it would balance the body and treat various diseases by removing excess or bad blood. The most common method of bloodletting involved making an incision into one of the patient's veins. This was typically done with a lancet, a small, pointed surgical knife. What were the hidden dangers of bloodletting? Bloodletting was often performed without a proper understanding of human anatomy. In some cases, patients died from the procedure itself due to infections or severe blood loss. Bloodletting was practiced for centuries in various cultures, ending only recently in the late 19th century with a history spanning at least 3,000 years. However, as our understanding of anatomy and physiology advanced, bloodletting fell out of favor. Lobotomy. Imagine a time when treating depression meant an ice pick through the eye socket. A lobotomy was a surgical procedure performed in the 1930s to 1950s to treat various mental illnesses like schizophrenia and manic depressive disorder. Lobotomies could have various side effects, including speech difficulties, personality changes, and cognitive impairments. Some doctors at the time considered the procedure successful if it eased the original mental health symptoms, even with severe side effects. How exactly did the lobotomy treatment work? The procedure involved making an incision in the skull, typically above the eyes, or inserting an ice pick-like instrument through the eye socket, reaching the frontal lobes. The surgeon would then sever or damage the nerve fibers, healing the illness. Even though some patients improved after getting a lobotomy, the procedure became less popular as more effective and less damaging treatments for mental illness became available. Electroconvulsive therapy. Imagine undergoing electroconvulsive therapy, an electric shock treatment, to address mental illness or even attempt to change your sexuality. Electroconvulsive therapy was a medical treatment that was used to treat patients with certain types of mental illness, including severe depression, mania, and schizophrenia. Because homosexuality was considered a mental disorder, some individuals underwent electroconvulsive therapy in attempts to change their sexual orientation. When was shock therapy first used? It was first developed in the late 1930s, with the first recorded treatments taking place in 1941. Electrodes were strategically placed on the patient's scalp, and an electric shock was delivered through the electrodes, causing a seizure in the brain. While the precise way ECT works is not fully known, it is thought to affect brain neurotransmitters like serotonin and dopamine. While ECT has evolved over the years, it remains a viable option for some individuals who do not respond to medications or other therapeutic interventions. Lithotomy. Imagine a surgical procedure through the genital area to remove kidney stones. A lithotomy, evolving from 300 BC to the 19th century, was a surgical procedure for removing bladder or kidney stones. The lithotomy procedure was performed without modern anesthesia and had high risks of post-operative infections due to a lack of understanding of hygiene protocols. How did they perform the lithotomy procedure? The patient was placed in position, lying on their back with their legs raised. The surgeon made an incision in the area between the rectum and the scrotum or vulva. Using specialized instruments, the surgeon reached the bladder or urinary tract and removed the stones. Fortunately, as medical knowledge and surgical techniques advanced, lithotomy procedures became more refined and safer. If you found these historical practices as spine-chilling as we did, subscribe for more intriguing content, and don't forget to hit the like button and the notification bell. Which of these procedures shocked you the most? Let us know in the comments below.